Hi everyone, my name is Brittany and I'm the wellness coordinator here at Canada Hospital, and I'm here today to show you some exercises that I did before I was pregnant and how I've modified them now, and also to tell you that it is safe and recommended to exercise while you're pregnant. You always want to speak with your doctor first, but if you have been doing an exercise regimen before you got pregnant, most of the time it's safe as long as you just, when you progress, to modify things as needed. As far as cardio, I had been doing the treadmill, the elliptical, and the bicycle ahead of time before I got pregnant. So ways to modify: I enjoy the bicycle because it's a low impact exercise. I also enjoy the elliptical because it's a low impact exercise. The treadmill, as I got a little bit further along, was something that I realized that just was not working out for me. So I just modified it by using the bike and the elliptical. I always had to remember that if it's very difficult for me, or if I'm very out of breath, then it's also going to be taxing on the baby. So that's something to keep in mind. It's called a talk test, and if you cannot talk to someone or the person next to you because you're so out of breath, then normally it's a little bit too much. So that was a good way for me to remember. And then I would also track my heart rate. And based on my max heart rate, I would just try and keep it within 50 to 60%. And that is what made me feel good and comfortable. And that's what's important. You know your body and you want to listen to your body. One of the exercises I love to do are squats. The biggest modification I made for this was that I started to put a ball behind my back and I would lean against the wall to do my squats. So then this way I made sure that I was still keeping my weight back. Obviously you have a little more weight in the front as you get pregnant, so I wanted to make sure I was keeping my form. It took a little bit of pressure off me, and then it was just more comfortable. So that was one way that I modified it. And I also don't go down into the squat as deep, and that just felt better on my knees as your joints and your ligaments start to loosen up as you're pregnant. My favorite exercise is the push-up, and I love to do them. It's also a great core exercise, which you want to work on, especially as you get further into your pregnancy, you start to lose that core. So what I did for this was that first, instead of doing the full push-up, I just dropped down to my knees and I could just do the push-up on the ground, but I was modified. And now I'm at the point where I'm 35 weeks and it's even more comfortable to use something like a countertop height. In the gym, you can use a Smith machine, you can use the bar there. You can even use a chair that's maybe pushed up against the wall. And then just your angle is not as low, so it's just not as hard on you, and you don't have to recruit as many core muscles, but you're still getting the effect for your upper body. All right guys, so just to wrap it up, overall exercise is recommended when you are pregnant, and of course speak to your doctor first. But whether you had an exercise regimen before and you decide just to modify it as you progress in your pregnancy, or you decide that you do need to start doing a little something, it is safe. I would recommend that if you were not, or if you were sedentary and then you got pregnant, a brisk walk, 5, 10, 15 minutes, whatever works for you, is actually recommended as well, especially if you're sitting at a desk, your feet are swollen. It's going to help with circulation, it's going to help with your energy, and overall it's just going to help you feel a lot better. It's always good too. You can do small back exercises, you can do stretches. Keeping active actually will be more beneficial for you, and so don't be afraid. Always seek the help of a professional if needed. We here at the Wellness Center would be happy to help you anytime.